Thank you for joining us for this special series of This is Getting Old, sponsored by the 2020 George Washington University's University Seminar Series. Towards Age Friendly is brought to you by Melissa B., PhD, in collaboration with GW Center for Aging, Health, and Humanities. Welcome to This is Getting Old. I'm your host, Melissa Batchelor, and today we're going to be talking about the age-friendly ecosystem. And I'm joined by Dr. Terry Fulmer and Amy Berman of the John A. Hartford Foundation. So welcome, ladies. So happy to have you with me today.
Great to be here.
So maybe before we get started, you can introduce yourselves, and then we'll dive into what an age-friendly ecosystem is.
Melissa, thank you. We are so happy to join you today. And on behalf of the foundation, this is a great opportunity to talk about age-friendly ecosystems. I'm Terry Fulmer, the president of the John A. Hartford Foundation, and our foundation is dedicated to improving care of older adults, no matter where they are, no matter who's giving that care. And that means to us that you have to not only think about age-friendly health systems, but fully an age-friendly ecosystem, which we're very excited to talk about today. Amy?
Thanks, Terry. Melissa, it's also a great pleasure to be with you today. I'm Amy Berman. I'm a senior program officer at the John A. Hartford Foundation. And I also share Terry's passion and long-term commitment to improving the care of older adults. I'm also a nurse. And at the John A. Hartford Foundation, I've led our efforts to improve serious illness and end-of-life care. And that particular interest is in spreading also evidence-based models of care and evidence-based approaches, like we're doing with our age-friendly health systems movement, an important part of the age-friendly ecosystem that I'm sure we're going to talk more about today.
Yes, and we actually have done a series of podcasts on the age-friendly health system where we did an overview and then did one for each of the 4 M's. I've actually heard feedback from faculty who are putting those podcasts into their classrooms to educate future healthcare professionals. So excellent work. So I guess the first question is, what exactly is an age-friendly ecosystem?
I'd be happy to explain that to you, Melissa. An age-friendly ecosystem refers to the collective of all efforts to adapt society to meet the needs of older adults around the world. We've had a movement to create age-friendly cities and communities started by the World Health Organization and carried forward in this country by AARP. Any mention of our work to make health systems age-friendly and what we're doing refers to public health as well. Employees, universities, and other sectors are working to meet the needs of our growing older adult population, and the age-friendly ecosystem represents all of those efforts. I often say you can't be an age-friendly city if you don't have an age-friendly health system or an age-friendly public health system. These things need to roll up, and we're very excited about that, and we're working hard to get that intersection.
Yeah, I kind of began this journey with you back in March of 2019 when you came and I had moved to the DC area. DC was an age-friendly city, and I mentioned the age-friendly health system, and they had not heard of it. And so since then, I learned about all these different age-friendly initiatives, and so it's been really fun to watch it evolve over time.
And I'll add one more thing about that, if I may, Melissa. The foundation's been working with an organization called Age Friendly Foundation to convene leaders of these age-friendly movements. And our goal has been to help make the age-friendly moniker clear to all stakeholders in terms of what it means, how we measure it, and how we think about it. Otherwise, our concern would be that people would say age-friendly, but they wouldn't have the substance to be able to define it and to measure it and to know when it's happening and when it's not happening. So the work helps us develop a common language and shared metrics so that anyone can recognize it and know what should be expected when we say age-friendly.
And just building on what Terry's talking about, building on that common language, also each one of these initiatives has its own guiding principles and its own framework. So a big part of our effort is to help each of these efforts understand those frameworks and what they share in terms of their characteristics. So I can give you an example. So with the age-friendly health systems movement, which I know you've discussed on previous podcasts, and by the way, your podcasts are wonderful, Melissa. The age-friendly health system, their framework reliably delivers evidence-based care that reduces harm and focuses on what matters most to older adults and their families. So the framework, the 4Ms framework, the 4Ms are what matters to the older adult: medication, mentation, and mobility. And then in the age-friendly public health systems movement, they have something called the 5Cs framework. So that one is connecting, coordinating, collecting data, complementing and supporting existing efforts and services. And then these things, these two frameworks, are for very specific sectors, either the health sector or the public health sector, for example. But undergirding all of these frameworks are commonalities that lead us to the characteristics of this age-friendly ecosystem.
Right. And I do think that's probably an important thing. It's not like, to be age friendly, it's not like there's a certain set of rules. Each initiative kind of came up with their guiding principles and frameworks to say, this is the target, figure out where you are on the spectrum, because the age friendly universities has the 10 principles. And then, each organization and sector is working towards kind of meeting all of the principles. And so given that, what are kind of the characteristics of an age-friendly ecosystem?
That's been a really fun journey to work that out as a collective group. And the convening of our leaders has not only helped us use survey data from older adults, but literature reviews and expert interviews have led us to understand that there are 6 fundamental characteristics that represent an age-friendly ecosystem. And let me tell you what they are. I'll give you 3. An age-friendly ecosystem is responsive. That means it's person-centered and tailored to meet the needs of diverse older adults. It's equitable. To be age-friendly has to inherently address disparities in outcomes based on race, ethnicity, socioeconomic status, ageism, and other factors. It is healthful. An age-friendly ecosystem is healthful, encompassing physical and mental health, wellness, and prevention. Amy, why don't you add the next 3?
Oh, sure, Terry. And the other 3 are engaging. So that means creating opportunities for older adults to fully participate and contribute to society. Active, and that means implementing programs, practices, and policies that optimize older adults' mobility, their sense of freedom, their independence. And the last one is respectful. And we heard this from older adults who participate in the initiative, who rightfully want and deserve dignity and respect. They don't want condescension or a paternalistic approach. So understanding these characteristics help us to get to that common language that Terry talked about and a shared set of metrics.
Yeah, I think one thing I probably appreciate the most about the age-friendly work is how inclusive it is. Because, with some of the other characteristics that you just described, not everyone fits into that bucket. But one thing about aging, we are all doing that. And so I appreciate that the characteristics are inclusive. They pull everyone together around this common thing, because it's a blessing to get to be an older adult, but we need to make sure that the world is friendly when you get there. So if a common language and metrics are needed, where are you in that process?
Well, we're at a really exciting point. We are beginning this work through the convenings that we've just held. We had one in December and one in March, where everybody worked very hard to come together and hash out what it meant from their unique perspectives. We had members from the World Health Organization, we had health system leaders, public health system leaders, sociologists, anthropologists, people who think about aging in unique ways. And certainly our age-friendly university system, one of our newest comers, had lots of good ideas. So we are very pleased that Kim Dash from the Education Development Center has drafted a paper, which we hope will be in press soon, where we'll be able to share with you those very specific metrics. Our colleagues at the Age-Friendly Foundation have begun really by developing that draft measurement taxonomy. And we identified the 6 outcomes measurement domains that represent dimensions of age friendliness. So the domains are groups of similar outcomes, and the outcomes are explanatory concepts that can be inferred from measuring or observed data. We're also looking at indicators or ways of measuring desired outcomes, and we look at all the different framework outcomes and indicators, age-friendly health systems that Amy mentioned, age-friendly public health systems, WHO age-friendly cities, AARP livable communities, the age-friendly cafe, and the university principles you mentioned, Melissa. So to supplement the work in health and public health, we're also have reviewed the CDC's Healthy People 2030 indicators for healthy aging and access care and the Association of State and Territorial Health official policy statements on aging to expand and quantify outcomes. So really starting with specific outcomes such as mobility, walkability, access to jobs, labor force engagement, and for each outcome, identified indicators or measures as recommended by IHI, CDC, WHO, and so on. And so in some cases, we've added indicators where there are gaps, and this is in draft, but moving very, very quickly. Our next meeting will be in June.
Okay. And Amy, I have to say that your dog is so cute. Very much enjoying our conversation today. So if someone listening today wanted to learn more or wanted to be involved with how to build the age-friendly ecosystem, I know at George Washington University, we're going to be hosting a regional age-friendly ecosystem summit to try to bring 5 different age-friendly cities and communities together to share with them, what an age-friendly ecosystem looks like and what each of them are doing, because I think so far everyone has worked in silos, but if someone wanted to learn more about the age-friendly ecosystem, or how do we begin to do this kind of multi-sector partnering, where could they learn more?
So first of all, I love the way that you framed that. We have to all come together. This is a big tent moment. And so we call on everyone to implement age-friendly programs that have the ecosystem characteristics we described: responsive, equitable, healthful, engaging, active, and respectful. And in whatever sector you are, please be sure to reach out across and with others. We've seen great success in this with public health, working with aging services and working with health systems. And to join the existing age-friendly initiative, you can go join the age-friendly health system movement by going to ihi.org/age-friendly. You can also visit the agefriendlyfoundation.org, which is beginning to really ramp up their content, which will be so valuable to all of us as we move ahead. And also visiting Trust for America's Health or our johnnyhartford.org website for more information on how to join the age-friendly public health system initiative. And this all connects to a very important issue and call to action. Everyone has a role to play in eradicating ageism, which is discrimination based on age. This means calling it out when you see it and hear it, and it requires you to make sure that you aren't contributing to ageist perceptions or older adults. Amy and I live this mantra every day, and we know you do too, Melissa. And thank you for the great work you're doing at GW to make sure that this is multiple of multiples. And we really are so proud of the work that you're doing to advance this effort.
Thank you. We'll let people know that we have done a podcast on age-friendly universities with Dr. Joanne Montapar, who's the research interest group leader with GSA, Gerontological Society of America. We have done age-friendly public health with Megan Wolf. And so both of those are available, and we're going to be doing one on age-friendly businesses/employers. And we've done a couple. I did one yesterday with See Me at the Smithsonian, which is kind of our arts and creativity sector from the work that we've been doing. Amy, do you have any final thoughts or anything that you would like to add?
Well, I would just echo what Terry said, which is this is a great opportunity for anyone who is listening to this podcast. If you are an older adult or a family member who cares about someone who is an older adult, this is your opportunity to demand this kind of care, this kind of ecosystem. If you come from any one of these sectors, whether it's health, public health, university, this is a very open and accessible movement, and we welcome you to be a member, a player in this wonderful, wonderful effort.
Well, I couldn't agree more. Any final thoughts from you, Terry?
Just to again, thank you. And on behalf of the John A. Hartford Foundation, thanks to everyone across the nation who's doing so much during COVID. And as always, in thinking about the way that we celebrate the success of longer lives and all we need to do to make those longer lives healthy and happy lives.
I did want to go back to one thing Amy just said. I do think that this, and you've said this before, Terry, it needs to be a kitchen table to kitchen table type of movement, but it also needs to be consumer driven. And I think that, by one of the whole points of doing, Welcome to This Is Getting Old, moving towards an age-friendly world podcast is to make people aware that these initiatives are going on and that you can engage with them. Look on the AARP website to see if you're in an age-friendly city or community, and contact AARP to say who else in our region or in our area is doing this work. Because it does take more than just a few people. It's going to take all of us working together.
All of us is right.
All right. Well, thank you very much, ladies. And I look forward to advancing the age-friendly ecosystem.
Thanks, Melissa. Good luck with all your work and for the opportunity. Thanks.
Thank you.
Thank you, sir.
Thank you for joining us for this special series of This Is Getting Old, sponsored by the 2020 George Washington University's University Seminar Series. Towards Age Friendly is brought to you by Melissa B., PhD, in collaboration with GW Center for Aging, Health, and Humanities. Thank you for joining me for this week's episode of This Is Getting Old, Moving Towards an Age-Friendly World. You can find more episodes like this on my YouTube channel, Melissa B., PhD, and don't forget to subscribe. You can also visit my website, melissabphd.com, and check out the podcast and blog section, because that's where I put all the hyperlinks and different things that we may talk about in any given episode. You can follow me on social media, Twitter, LinkedIn, Instagram, and Facebook. And you can also find the audio version of the podcast on iTunes, Stitcher, Spotify, and Amazon Music. So I hope this podcast gives you ideas of different things that we can do to move towards an age-friendly world, because when the world is age-friendly, it's friendly for everyone.